Good morning. I call the meeting of the Senate Committee on Finance and Revenue to order, and today is Wednesday, May 21st, 2025. It's approximately 8:06 a.m. And at this time, I'm going to be announcing that I will be rolling over the work sessions for Senate Bill 387, Senate Bill 225A, and House Bill 2081. And at the conclusion of our public hearing, I will be doing a work session on Senate Bill 143. So at this time, I'm opening public hearing on Senate Bill 702A. Thank you, John. Mr. Hart.
Thank you. Mr. Chair, members of the committee, Senate Bill 702A prohibits the retail sales of flavored tobacco and nicotine products at all locations other than liquor stores established by the Oregon Liquor and Cannabis Commission. It prohibits providing any tobacco or nicotine product without compensation. It requires sales of tobacco and nicotine products take place at licensed locations and allows local governments to impose requirements or prohibitions that are more strict. I will say that we have posted in OLIS an amendment that I did not have time to review in detail, but it has been described as technical changes. And we also have preliminary revenue estimates associated with this restriction to the OLCC stores. That works out to about $18 million revenue reduction per year up front, but because these are declining revenue sources, that does decline in later years.
Very good. Thank you, Mr. Hart. And just to let folks know, we have quite a list of witnesses signed up for this bill this morning in this public hearing. So initially, I have our legislative members going to be introducing the bill. We have a couple of panels. I'd like to see if they could limit their testimony to the panels 9 minutes each. And if you can mute your mic online, please. And then when we get our other witnesses up, fortunately, I probably have to limit to 2 minutes each. But also, please know that we read all of your written testimony, so you have 48 hours from today, this 8:06 a.m., to submit written testimony. And thank you very much for being here this morning. So I'd like to call up our first panel, Senator Reynolds, Representative Javity, and Rep. Pham. And Rep. Pham, is he online?
I texted him, yeah.
Oh, he'll be arriving. So thank you. Welcome, Senator and Representative.
Thank you. Give me 1 minute, I'm just gonna.
Oh, that's lost 1 minute. Welcome, Senator.
Good morning. Good morning, Chair Meek, Vice Chair McLean, and members of the committee. My name is Lisa Reynolds, and I'm the State Senator for Senate District 17. It's an honor to appear before you today to bring forward this important bill, Senate Bill 702, which limits the sale of flavored tobacco and flavored synthetic nicotine products in Oregon. And I'm quoting from the bill, at or from premises that is established as a store by the Oregon Liquor and Cannabis Commission under ORS 471.750. Briefly, this measure defines characterizing flavors. It expands the definition of nicotine to include synthetic and emerging products, and it restricts the sale of flavored tobacco and nicotine products in our state. Of note, this measure excludes FDA-approved smoking cessation products, and it has a long runway with an implementation date of July 1st, 2026. As you know, I'm a pediatrician, and it is that work that informs all that I do in the legislature. It is the very health and safety of our youngest Oregonians that is at the heart of this measure. Restricting the sale of flavored tobacco in Oregon would limit the lifelong nicotine addiction and the short-term health impacts, including ER visits for nicotine toxicity, I read those reports, and the long-term disease wrought by these products. Flavored tobacco products encompass a broad range of forms, from menthol cigarettes to sweetly flavored aerosol vapes, as well as flavored chew and cigars. Can I grab my props? Just going to put a few props up here. This is, thank you. Flavors include cotton candy, mango, strawberry shortcake. These flavors mask the noxious, tarry taste and smell of tobacco, which would otherwise deter a young person from smoking traditional cigarettes. Indeed, we've seen that revenue from traditional cigarette taxes is going down. And put simply, these palatable flavors are a gateway. And these products are delivered in packaging that mimics and smells like candy if you smell this bag. And this particular product contains an actual video game or electronic game on its cover. We call these vapes for vaporized nicotine, and they're explicitly designed for children. And then children become addicted for life, hooked by the high levels of nicotine, which is one of the most addictive drugs on the planet. And I've certainly seen young patients in my own practice who are struggling to quit this addiction before they're even able to drive, before they get their first job or graduate high school. And in these young people, nicotine triggers symptoms of ADHD, anxiety, and depression. And furthermore, they tell me how demoralizing it is to want to stop using a substance and really not be able to. So I'm here today putting front and center the health and safety of Oregon children. Let's talk about the tobacco, or really the nicotine delivery industry. This industry has purposefully targeted youth with its marketing of flavors. Where we see a child, the tobacco industry sees a new client and one that will become a lifelong customer. I mean, look at these. In Oregon alone, the tobacco industry spends $100 million a year on advertising to market their products as cool and trendy and safe. Our kids are up against a massive and deceptive industry. In fact, one vape country, Juul Labs, has paid out nearly $500 million in the country to settle an investigation which found that they were intentionally, wrongfully, and repeatedly targeting children in their marketing. Oregon received $20.5 million from Juul over this unlawful marketing, and now they only sell unflavored products except for one menthol version. Restricting the sale of flavored tobacco through Senate Bill 702 is about making it much harder for kids to access these products and become addicted to nicotine, which sets them on a path for lifelong tobacco use, leading to, as we know, lung damage, heart disease, and yes, early death. Our communities are fighting back. County commissioners in Multnomah County and in Washington County have chosen to protect their constituents by ending the sale of these products in their counties. In Washington County, Big Tobacco tried to overturn Washington County's ban, and 77% of voters voted no on that overturn. Do not sell flavored tobacco in our county. The Oregon Court of Appeals has upheld both counties' actions, and the Oregon Supreme Court is slated to hear Washington County case in 2 weeks. It'll be a field trip for my office. Other states are taking action. California, Massachusetts, New Jersey, and New York, and Rhode Island have already successfully ended the sale of flavored tobacco in their borders. And I'm here today putting front and center the health and safety of Oregon children. By limiting access to products to highly controlled OLCC stores, we still allow adults to legally purchase flavored tobacco for their own use while preventing easy access at convenience and grocery stores where young people regularly purchase other products. Research has shown that limiting access to state-controlled 21 and over liquor stores reduces youth access. In Oregon, it means we limit access to these addictive products from nearly 3,000 tobacco retailers to 280 OLCC stores. OLCC stores are already able to sell tobacco, and today, currently, 133 stores have a license to sell the products. Limiting the sale of flavored tobaccos that are especially attractive to kids to fewer stores that are 21 and over for entry into the store is a strong step toward preventing access to kids and protecting them from a lifelong of addiction. I urge you to join me in this effort by passing 702 as amended out of your committee, and I appreciate your time. Thank you.
Thank you. Welcome, Representative.
Thank you, Chair Meek, Vice Chair McLean. My name is Cyrus Javity, State Representative for House District 32. Thank you for the opportunity to speak today. I'm a practicing dentist, and I represent the people of a rural community on the North District, on the North Coast. I'm here today, not my role as a legislator, and that would be interesting, but as a healthcare provider who spent 2 decades watching what nicotine does to the human body up close. I'm not here to demonize adults who make choices, nor do I believe the government should substitute its judgment for theirs. But I do believe we have a responsibility to protect children from products that are biologically engineered to hijack their decision-making before they've even finished developing it. Nicotine is not just addictive, it's insidious. In my dental practice, I've treated teenagers with gum recession, stained enamel, chronic dry mouth before they can vote. I've seen young adults who started with flavored vape pens, ended up with nicotine dependency that's tough to break and expensive to treat. One of my first experiences in Tillamook when we moved there, I was out of dental school a few years, but a young gal in her mid-20s had to have all of her teeth removed from tobacco use. She had just destroyed her teeth completely. I've talked to parents, many of them conservative working class families who are frustrated that the packaging of these products looks more like Halloween candy than a medical risk. This bill doesn't outlaw nicotine. It doesn't punish adults. It doesn't shut down entire industries. What it does is draw a line around one tactic, flavoring, that research shows overwhelmingly appeals to young people. From a public health standpoint, that's a sensible place to focus our effort. I also appreciate the bill still allows local governments to go further if their communities demand it. That's the kind of local control that I support. I know there are concerns from small retailers about how this could affect their sales. I think those are legit. That's a conversation worth having, and I hope the implementation period gives us time to be responsive to those concerns. But I'll say this plainly, in my years of practicing dentistry, I've never had a patient come in and thank me for getting them started on flavored nicotine. I have, however, watched too many of them try again and again to quit. Thank you for your time. Just on a personal note, and I shared this in a different committee, but I come from a family of smokers. My mom smoked. My grandparents smoked. I can still remember the smell of pipe and cigar tobacco from my grandfather, and I loved the smell of it. I looked forward to going to see him. I had friends growing up who smoked. I lived in Boston, and starting around the age of 14, I used to wait until my mom would fall asleep, and then we'd sneak out at midnight to walk the streets of this little Boston suburb where they would smoke, and I would hold a cigarette in my hands so I could look cool like them. I didn't ever inhale because I had asthma, and even the smell of tobacco smoke inside a building would trigger an asthma attack, and so. But I wanted to be cool. I would also shoplift with my friends and act as a decoy so they could get cigarettes. As you walked up to the cash register back in the 80s and 90s, the cigarettes would be right where the candy is, and you grab a pack and you bring it up to the front and you'd buy it. But if I bought some candy, they would sneakily, put a pack in their pants, and we'd get out of there. So the CDC says that 90% of tobacco users start before the age of 18. Think about that. It is the time when most smokers start. 99% start before the age of 26. The median age for starting daily cigarette smoking is 18.9 years old. Among young people 18 to 24, 13% report having smoked at least 100 cigarettes in their life. And among high school students who currently smoke, over 80% use flavored tobacco products. So, like I said, as a conservative leaning member of this legislature, I don't like to infringe on the rights of adults. I think if you want to inhale something that you know is bad for you, by all means do it. But what I like about this bill is it makes it just a little bit tougher for our youth to gain access to it, to see the marketing. And I think while I don't think this bill will completely eliminate smoking, I do think it will make an impact on the number of youth that do it, which I think long haul will be good for them, but also good for public health and the burden the state faces as we try to deal with the outcomes of that, which are quite expensive. Thank you.
Thank you, Representative Javity. Appreciate your testimony this morning. Representative Pham, is he here?
I think he might be in work sessions
Okay.
in another committee, so
We
if
can
there's a way
come
to
back.
slot him in later. I appreciate
Yes,
that.
we will
Thank you.
sure do that.
Thanks.
Thank you.
I'll take my.
Now I'd like to call up Wendy Hassan, Marlo McGrath, and Pamela Trangenstein. Steen. Yes, 9 minutes. Let's make it 8. Welcome, please. Thank you.
Chair Meek and members of the committee. For the record, my name is Dr. Wendy Hassan, and I am in front of you today as a pediatric critical care physician and the mother of 2 children. I am a board member of the Oregon Pediatric Society, which endorses this bill. And I am grateful for my colleagues today who are discussing the chronic repercussions of tobacco use in adolescents. And to all of those points, I fully agree. But I am here to give you a glimpse into what I see in the pediatric ICU, which is the terrifying and life-altering effects of e-cigarette or vaping product use-associated lung injury, also known as EVALI. EVALI is a severe and life-threatening lung injury that occurs as inhaled chemicals from vaping products cause profound inflammation and damage to often previously healthy lung tissue. And we see this in children as young as 12 or 13. At best, these teenagers may require an ICU stay to receive continuous oxygen. And at worst, the lungs become so damaged that the air sacs that exchange oxygen collapse on themselves and start to form stiff scar tissue. And when this occurs, a breathing tube is placed in these youths, and they are supported on ventilators until their lungs are healed enough to support themselves, a process that can take several weeks if it occurs at all. When the lungs are too sick to exchange any air, even that's provided by a ventilator, we then place these patients on full life support, in which the blood is removed from their body and run through an artificial lung before it is returned to the patient. In essence, when vaping takes away the body's ability to support itself, we in the ICU do it for them. But we do it at great cost. If you've ever had a child who required even just a short visit to an ER, then you know the emotional, social, and fiscal toll that this takes on a family. In Oregon, there are no critical care services for children outside of Portland, displacing these families from their homes, their jobs, and their support systems for weeks to months. And affected teenagers, they not only miss out on months of schooling and peer relationships, when they return to their lives, they do so with chronic disease, lifelong limitations, and a high risk of subsequent hospital admissions. Often, there is no return to normalcy for these once healthy adolescents who are simply doing what teenagers do, experimenting with risks that are made easily available to them. Admissions to the ICU for e-cigarettes or vaping-associated lung injury are entirely preventable. And this is why the Oregon Pediatric Society and I support this bill. A 90% restriction on where kids can buy flavored tobacco products will make a difference, and it will save lives and keep kids out of the ICU. So I urge you to vote yes on SB702A. Thank you very much.
Thank you, Doctor. Appreciate coming. Marlo McGilwraith, if you're
Hello.
welcome, and introduce yourself. My apologies for your pronunciation of your name.
No problem. If it's possible for the camera to be turned back on, that was disabled remotely,
we
but
will see.
that's okay.
We'll get you on.
No problem. Thank you, Chair Meek and members of the committee. My name is Dr. Marlo McElwraith, and I've been a pediatrician in the Portland-Beaverton area for the past 25 years on faculty with OHSU. As a physician, I strongly support limiting the sale of flavored tobacco products, and the evidence behind this position is clear and compelling. So flavored tobacco, whether in cigarettes, e-cigarettes, smokeless tobacco, or nicotine pouches, is deliberately designed to attract young, hold on, let me put this back on here. Whoop. There we go. Attract young people. According to the CDC, over 80% of youth who have ever used tobacco started with a flavored product. These flavors, like Senator Reynolds mentioned, mango, mint, cotton candy, they mask the harsh taste of tobacco and nicotine, which is something that often kids don't like, that harsh taste. But the flavors make it much easier for the adolescents to start and harder for them to quit. As mentioned, nicotine is highly addictive, especially in the adolescent period. Exposure during this time affects brain development, particularly areas responsible for attention, learning, and impulse control. Studies show that teens that use e-cigarettes are much more likely to go on to use traditional cigarettes. I'd like to talk a little bit about the use of Zyn, the Zyn product. The use of Zyn nicotine pouches among U.S. teens has surged dramatically in recent years. Zyn is a brand of nicotine pouches that's placed between the gum and the lip, allowing the nicotine to be absorbed into the bloodstream fairly quickly. A study from the Keck School of Medicine at USC found that usage among 10th and 12th graders nearly doubled between 2023 and 2024, rising from 3% to 5.4%. Notably, over 85% of these users preferred the flavored varieties, such as mint and citrus, and nearly a quarter reported daily use of these products. The discreet nature of these pouches and their promotion on social media have really contributed to the appeal among the adolescents. In talking to my patients and my 9th grade son, I believe that the number of middle and high schoolers using Zyns is even higher in 2025. In fact, I've seen vaping slightly lower in my patients and Zyns just skyrocketing. Many teens on my son's lacrosse team started using these Zins because they think they're less harmful to their health. They are definitely easier to hide than vape pens or cigarettes, and they taste good. When talking to them, really part of that big draw is that it tastes good. No one can smell a bad smell. It's really a pleasant and often fruity type of smell. From a public health standpoint, banning or limiting flavored tobacco to adolescents could dramatically reduce youth initiation. So they're not going to start it if it already tastes bad or feels harsh. It can also promote.
I apologize, Doctor,
Go ahead.
but the timer went off, and I just was asking you
No
to
problem.
wrap up. We do appreciate you. We have a huge list of witnesses signed up today. You can
No problem.
conclude and close, please.
As a pediatrician, a big part of my job is to prevent disease before it starts. Removing flavored tobacco products from the market for my adolescents is a great evidence-based step towards that goal. Thank you.
Thank you so much. And it's a Pamela Trangenstein. And I apologize, I have to just only give you 2 minutes.
Yeah, no worries. Thank you. Good morning, Chair Meek and members of the committee, and thank you for the opportunity to testify in support of this bill this morning. My name is Pamela Trangenstein, and I'm a scientist at the Public Health Institute and an expert in the role of retail environments and substance use. The speakers before me have done an excellent job explaining why flavored tobacco products pose a public health problem, so I won't belabor that point, except to say tobacco industry documents clearly show that these flavors are designed to serve as a bridge from candy to nicotine. Convenience shapes behavior. I think we all could identify that we're more likely to eat ice cream if it's already in our freezer, and just like that, people are more likely to use tobacco when it's easy to get. Areas with more tobacco retailers, they have more triggers. People see the products and advertising, and that can spark cravings and spur impulse purchases. And low and racially minoritized neighborhoods have more than their fair share of tobacco retailers. My team modeled the effects of restricting tobacco sales to state-run alcohol stores, and we found that in Oregon, retailer availability would drop by nearly 90%. An estimated 1.1 million fewer Oregonians would live within 1 minute of the closest tobacco retailer, and Black and Hispanic Oregonians would experience larger increases in travel time. State-run stores are not just fewer in number. They also have better compliance with ID checks and operate under stricter controls for advertising, hours of operations, and selling high-risk products. In my professional opinion, SB702 is a strategic, evidence-based approach to reduce access to flavored tobacco where it matters most, among youth and communities already overburdened by tobacco-related disease. Thank you for your time and your commitment to protecting the health of Oregonians, and I respectfully urge your support.
Thank you so much for your very brief and prompt and powerful testimony. Thank you. At this time, thank you so much, Doctor. I'd like to call up Senator Brock Smith, and then also the next panel will be Jonathan Polonsky, Sean Miller, and Danny Thompson. Welcome, Senator.
Thank you, Chair Meek, Vice Chair McLean. Colleagues, for your record, I'm State Senator David Brock Smith. I represent Senate District 1, which is Southwest Oregon's Fish Farm and Forestry District, and I am here adamantly opposed to Senate Bill 702. Colleagues, as we look at our budget, let's start there, and how we are hurting for resources and revenue to fund basic services in the state and education and healthcare. You just heard from the previous testimony that this will reduce the access and lower access to these products by 90%. Well, that's 90% of the revenue that comes in and hundreds of millions of dollars to support healthcare in this state that you're also going to be reducing. I appreciate the proponent of the bill coming and speaking to me about moving these locations to liquor stores. But frankly, colleagues, that is a horrible idea. Actually, liquor stores haven't been the best when it comes to ID programs and minors going in and dealing with that, the minor decoy issues. But more importantly, as alcoholism is on the rise in this state, where per capita consumption has been risen steadily since 1990 to 2021, you're going to be driving individuals, and maybe not pediatricians, but doctors recommend individuals that have that are recovering from alcohol that they go ahead and continue to use other substances such as nicotine delivery systems. And now you're going to be driving those individuals into liquor stores as the only option for them to be able to purchase their one vice that they have shifted to, which is absolutely insane. You've already heard testimony from the proponents of this bill that counties in this state have passed these ordinances to eliminate flavored tobacco from their counties. And so there is no need for this piece of legislation, as if individuals or counties want to move forward in banning these products, they can do so. And colleagues, I am a flavored tobacco user. Most individuals that enjoy a cigar or two are a flavored tobacco user. I smoked for 30 years of my life, tobacco cigarettes. I quit in the middle, March of the 2023 legislative session. And the reason and the ability for me to do that is because I was able to transition from tobacco cigarettes to flavored vape. And colleagues, I just want to also add, if you really want to keep these individuals, youth, from purchasing these products, then look at the Dash 4 Amendment. The Dash 4 Amendment that I have submitted to this committee is a amendment. We had a previous piece of legislation that moved through this legislative body this session that would require any establishment that is selling flavored or tobacco and nicotine products in general to use the 21 and over card readers that are being used in other establishments and some of these establishments. And so therefore you would eliminate the ability for youth, if you will, to purchase these. And finally, because of the tax implications on this legislation, I would hope that this committee would be advocating for this bill to go down to Ways and Means, because if you're going to be gutting potentially 90% of the revenues coming in to this state from the tax revenues off the sale of these, it is going to hurt our already stressed budget. Rural Oregon is not urban Oregon. Portland is not Port Orford. I have one liquor store in Port Orford that is owned by an older gentleman, and he is not going to be selling flavored tobacco. Roseburg, for example, with nearly 25,000 people, has 2 OLCC liquor stores. In this negative business climate from this body's policies, why are we closing down privately ran businesses that generate jobs and generate revenue to the state and giving them to, and those resources, to state-run liquor stores? I urge you to not move this bill forward. Allow the counties and other to be able to move forward in their own way with their own ordinance, as it was testified before Multnomah and Washington counties have done. Thank you.
Chair Meek.
Yes, yes,
May I
Senator
ask a question?
Patterson,
Is that all
please. Please.
Thank you so much, Chair Meek. Good morning. Good morning, Senator. I have a question, since we're a Finance and Revenue Committee, and that is related to the loss of tax income to the state. If you've done a cost-benefit analysis as to what are the tax savings versus the healthcare costs that we're going to have at the end of the day with the number of young people who get addicted to tobacco and then their lifetime healthcare costs. I think that we need to, as a state, look at the bottom line, and that's one thing we should take into consideration. I wonder if you've done that cost-benefit analysis.
Well, I think you know the answer to that question. I don't think that anybody can do that cost benefit. Sorry, Chair Meek, Vice Chair McLean, Senator Patterson. I don't think anybody can do that cost benefit analysis. But I wonder if you're requesting it, maybe the people with the letters behind their names that it might be in the room or listening can do that. I wonder if they'll also include, because tobacco is already illegal to purchase in this state. You have to be 21 to purchase this any of these products in this state. That I'm not under the misconception that this is going to stop that for occurring, but I am, and I do believe that, and I would add to your request that it would be interesting to see the uptick of alcohol sales and alcoholism in the cost of this state associated with driving people to liquor stores in order for them to purchase tobacco.
Chair Meek, may I make one more follow-up comment? My assumption is that all the stores who currently sell flavored tobacco do sell at least beer. I can't think of very many convenience stores or large grocery stores that don't sell beer and often wine as well. I realize they don't sell hard liquor, but just wanted to put that on the record. Thank you.
Well, Chair Meek, Vice Chair McLean, as a former restaurant and bar owner and a member of the governor's opioid task force and on, there's a big difference between a Coors Light and a bottle of Hennessy.
Thank you very much, Senator.
Thank you.
I'd like to, before I call up the next panel, give Representative Pham a chance to come up and give his testimony. Representative, if you can just keep it to 2 minutes, I'd really appreciate it. Welcome up. And then Jonathan Polonsky, Sean Miller, and Danny Thompson, you'll be on deck. Thank you. Welcome.
Thank you, Chair. Good morning, Chair Meek and Vice Chair McLean. For the record, my name is Hai Pham, State Representative for House District 36. I'm also a practicing pediatric dentist. Been doing this for almost 20 years for my other day job. I'm here in support of Senate Bill 702. Flavored tobacco products and vapes in particular have been marketed as safer than traditional cigarettes and come in flavors such as cotton candy, orange soda, and now in forms of video games that cost only $10 or $15 that target youth. The toll of tobacco is clear, the number one cause of preventable death and disease, and yet tobacco kills over 5,500 Oregonians directly from smoking every year. In the spirit of the revenue committee, I want to specifically emphasize the cost of tobacco and speak to Senator Patterson's comment. The Oregon Health Authority estimates that tobacco use costs Oregonians an estimated $5.7 billion a year in medical expenses and lost productivity. The same report shows that tobacco-related deaths are more prevalent in rural counties, including Klamath, Lake, and Coos County, just to name a few. This can mean great cost to the healthcare system, especially in rural areas of a state where access to care can be limited. And these numbers don't even include tobacco-related diseases like cancer, cardiovascular disease, diabetes, asthma, and which all add to the strain in healthcare system and increase costs to the state. I want to emphasize that this isn't a complete ban, as we've heard, and there were a lot of compromises that were made to get to this point. So in the midst of a youth mental and behavioral health crisis and significant underinvestment in the state's public health, we need to be doing more to protect families and kids from a lifetime addiction to nicotine. I urge your support of Senate Bill 702A.
Thank you, Dr. Pham. Appreciate it. Okay, Jonathan Polonsky, Sean Miller, Danny Thompson, you're welcome up, please. And I don't know how you want to divide it up, but I'll give this panel 10 minutes. Okay.
Thank you, Chair Meek, Vice Chair McLean, members of the committee. Sean Miller, I'm here today on behalf of the Northwest Grocery Retail Association in opposition to Senate Bill 702, which, as you heard, moves the sales of flavored tobacco to state liquor stores, which is a sizable portion of our sales, from over 3,810 retail stores to the limited 282 liquor stores in our state. I did want to talk about briefly some of the tobacco provisions that we have supported in recent sessions. First of all, moving the age of 18 to 21, and second, a comprehensive Oregon retail licensing program for tobacco, which not only regulates but adds enforcement, which was the purpose to prevent underage sales. If you've gone into our large grocery stores, you see that we do a lot and take it seriously. I would agree with the advocates of the bill that we do not want this in the hands of our underage youth. We lock up those products. They're normally behind a service counter, and you have to have a manager normally get those products, give them to the consumer, and obviously we card and make sure that we're not selling to underage minors. And real briefly, commenting on some of the flavors involved, the cotton candy, some of the other flavors that you talk about that we've heard. We don't sell those products. A lot of those products come in from China through the illicit market. We go through and sell FDA-approved products, and so I do want to point out that our stores take that seriously and aren't selling those products that you hear frequently. And I want to get into just the flaws of Senate Bill 702 and correct the record on compliance rates, and I want to get into that detail. If you look at, again, this bill does just penalize our members and puts it in OLCC stores. And I want to take 2024 data and look at the actual compliance numbers from the Oregon Health Authority as well as the OLCC. And if you look at first the Oregon Health Authority data, this is the year of 2024, and the grocery store market, this is through the inspections reports, we have a 16% violation rate. So again, that's an 84% passage rate for selling to minors. If you look at OLCC's minor decoy program, which again is trying to enforce the underage sales to minors, if you look at their off-premise sales, which again are my members, grocery stores, as well as the convenience stores, we also have an 84% passage rate. So that's a 16% violation rate. If you look at liquor stores through the OLCC minor decoy program, they have a 68% passage rate. So that's a 32% violation rate. That's double the violation rate from our stores. So this particular bill, who was, again, an attempt to try to stop underage minors, is taking it out of our stores and putting it into stores who have a double violation rate for selling to minors. So again, I wanted to point that out, correct the record, because this is actual data from the OLCC and OHA, and I turn it over to my colleagues. Thank you, Mr. Chair.
Thank you. Yeah. Please mute your mics online, please.
Good morning, Chair Meek and members of the committee. My name is Danny Thompson, representing Brightside Distributing. I urge you to oppose Senate Bill 702. Brightside Distributing employs 39 hardworking Oregonians who rely on their jobs to support their families. This bill doesn't just threaten our employees, it jeopardizes jobs across the supply chain, including wholesalers, distributors, and union workers who deliver the goods. Senate Bill 702 would cut jobs not only in retail, but also the industries that support it. This bill picks winners and losers, unfairly targeting responsible retailers while driving sales to unregulated online and black market sellers. History shows bans like this don't work. In states like Massachusetts and California, illicit markets have thrived. State tax revenues have suffered. Oregon's youth smoking rate is already at an all-time low of 2.1%, thanks to enforcement and education, not prohibition. Responsible retailers, like those we supply, are far better at preventing underage sales than government-run stores or unregulated platforms. They comply with strict ID checks and regulations, unlike black market sellers who operate with little oversight. Instead of banning legal products, lawmakers should focus on enforcing existing laws, cracking down on illicit sales, and expanding education programs. Oregon needs balanced policies that protect public health and support small businesses, not another failed prohibition experiment. Please vote against Senate Bill 702. Thank you.
Thank you for coming.
Chairman, committee members, my name is Jonathan Polonsky. I'm the CEO for Plaid Pantry. We own and operate 104 convenience stores here in Oregon. I'm opposed to SB 702A because I have serious concerns about moving all flavored tobacco products from over 3,000 private outlets to just 282 OLCC stores, half of which don't currently have tobacco licenses. While I understand the public intentions behind the proposal, the economic and equity implications are substantial and troubling. First, there's the impact on state revenue. Flavored tobacco products currently generate significant tax income for Oregon, millions of dollars annually. Disrupting established retail channels will lead to a sharp drop in legal sales. History and data from other states suggest that restricting availability will drive consumers to neighboring states, tribal lands, or illicit markets, none of which contribute to Oregon's tax base. Second, the impact on local businesses. This proposal would effectively transfer literally hundreds of millions of dollars of consumer spending away from private, often family or minority-owned stores. These businesses rely on tobacco sales as well as the corresponding sales of other products as a key part of their revenue and may not survive a loss of such a high volume category. Third, there's the issue of equity and fairness. This proposal to move all flavored tobacco to a limited number of state-run stores gives a state a monopoly over a product it publicly discourages. It is not equitable or ethical, inconsistent with state to remove income opportunities from thousands of private operations. I've also submitted written testimony that focuses on compliance issues that need to be considered as well. Some of the numbers that Sean already alluded to are in my written testimony. I urge the committee to reject the proposal in light of the disproportionate harm to small businesses, tax revenue, and consumer choice. I appreciate your time and I'd be happy to answer any questions.
Thank you, Mr. Polanski. Yes, I appreciate you coming this morning. Just a quick question, just a verification. Some of the, well, for example, the Zen products are currently not regulated by age, but I understand a lot of your stores actually do have a policy in which you have them secured back with the other tobacco products. Is that true?
Correct, yeah, and there's some legislation that wants to change that to make it controlled, and we obviously would not be opposed to that at all. That's the way we treat all of nicotine products. They're all age restricted, and our compliance rate at Plaid Pantry is over 98%. It's the best in the state. And we're happy to share the playbook with any other retailers to get to that number.
And secondly, a lot of your Plaid Pantry operators, are these like franchises? Do you have individual owners? Is this?
Yeah, so Plaid Pantry, unlike 7-Eleven, is a corporately owned entity. So all of our 107 stores, 104 in Oregon, are run through our corporate headquarters in Portland, Oregon.
Okay. Thank you so much. Appreciate you coming this morning. Thank you, Mr. Miller. Oh, yes, Vice Chair McLean.
I would just love clarification from staff on whether Zen or the pouch products are age restricted. I've gotten different comments from people. I've heard the feds restricted, and I know that when I purchased some, I was carded, and I think despite my optimistic view, I don't look anywhere near 21. So I'm assuming that it was because of the training, which I think is absolutely appropriate, to just validate the sale of age-related products. Did not bother me. So what's the answer? Is it restricted by the feds to people, or is it restricted by the state, or is it not restricted?
Would you have that answer, Mr. Hart?
So I think what I heard in testimony for another bill, and time runs together, it was probably last week, was that there are federal restrictions, but we do not have the state restrictions on those products, and so state enforcement is curtailed by that.
Okay, then my follow-up comment is that it is age restricted. So at least when we have this conversation, we can all be on the same page. It is age restricted. And second of all, the sellers of pouch products have to comply with that, correct? The answer is yes, they do. So we want to be on the same page, at least in the discussion.
Yeah, thank you, Vice Chair McLean. Appreciate that. For the viewing audience and members here to sign up for witnesses, I do have one work session I need to work and get into the calendar, so I'm going to pause the public hearing for a few minutes. We have Director Gerstenfeld here waiting patiently to pass this bill, and so I'm going to do a quick work session. I'm going to open up a work session on Senate Bill 143.
Thank you, Chair Meek, committee members. The introduced version of Senate Bill 143 is a study bill that requires the state treasurer to study the administration of public funds. The -2 amendment before us replaces the bill. The -2 amendment increases the percent of unemployment insurance payroll taxes diverted to the Supplemental Employment Department Administration Fund. That change would apply to quarters beginning on or after April 1st, 2025. The -2 amendment also modifies the determination of the CDAF balance over which excess amounts are transferred to the Unemployment Compensation Trust Fund in odd numbered years. That change would apply to transfers for the biennium ending on or after June 30th, 2025. The revenue impact to the Unemployment Insurance Trust Fund is a decrease of about $45 million per biennium. The revenue and fiscal impact statements are available on OLIS, and all paperwork is in order.
Thank you very much. Vice Chair McLean, would you be willing to make a motion for the -2 amendment?
I move that we adopt the -2 amendment to Senate Bill 143.
Vice Chair McLean moves adoption of the -2 amendment to Senate Bill 143. Any discussion? Any opposition? -2 amendment is adopted, and I'll entertain a final motion. Vice Chair McLean?
I move that Senate Bill 143 as amended to the floor with the due pass recommendation.
And be referred?
No, there's
Oh, there's no referral? Excellent. Vice Chair McLean moves Senate Bill 143 to the floor with a due pass recommendation. Any discussion?
Yeah.
We had this hearing. Go ahead.
Yeah, I'll be a yes today to move the bill. But I think I still had a couple of unanswered questions, but I didn't realize we were going to move this bill today, so I didn't get them answered. But I'm happy to vote yes, so we can move the bill.
Great. Thank you, Vice Chair McLean. We're trying to provide certainty to the Oregon Employment Department with their budget, and LFO is waiting for this information in order for us to approve their budget in our subcommittee, Senator Starr. So that being said, I'd like to call the roll, please.
Senator Patterson?
Aye.
Senator Starr?
Aye.
Senator Taylor?
Excused.
Vice Chair McLean?
Aye.
Chair Meek?
Aye. Motion passes, and we need to assign a carrier for I will take that Meek as carrier. And closing, if all paperwork is completed, closing work session on Senate Bill 143, and now calling up witnesses for the resuming public hearing for Senate Bill 702A, calling up Julian Guerra Molina, Miles Kinney, and Ruby Weigler. Welcome. And please, we'll have to be at the 2 minutes each, and thank you for coming.
Good morning, Senator Meek, other senators. My name is Julian. I am a senior at Oregon City High School. I'm one of Senator Meek's constituents, actually, and I'm also the chair of the Oregon City Youth Advisory Commission. I'm here today in support of Senate Bill 702A. I think we can all agree that the responsibility of the government is to protect the health and safety of their constituents. As minors, we don't have a formal voice in the government, so we look to you, right, to set those standards in place to protect, people like us.
You can step back a little bit from the mic. There you go. That's perfect.
Miles can attest to this, being someone that goes to school with me, right? We both know many, many people that use nicotine products on a day-to-day basis. It is a real issue, and we really don't have a voice in any of these conversations, right? So we do look to the adults in the room to say, the safety of children matter more than whatever tax revenue comes into the state, whatever money corner stores make, however much Plaid Pantry gets from nicotine. Money is not more important than people's health. It's not more important than children's health. And I think that's just something that we can baseline all agree with. So I really just can't see an argument being made against the bill. So yeah, I think we should support SB702A.
Thank you. Welcome.
Good morning. My name is Miles Kinney. I'm a student at Oregon City High School, Vice Chair of the Youth Advisory Commission of Oregon City, and one of your constituents. I'm here today to support SB 702A. At this point, flavored nicotine products have just become a normal norm for teenagers. You see them at school, you see them in backpacks, cars, bathrooms, everywhere. It's part of life. People don't really think that's a big deal anymore, but it definitely is. It shouldn't be normal for 16, 15, even 14-year-olds to be addicted to something like nicotine. It should be normal to be anxious because you don't have your vape. It shouldn't be normal to nicotine to pass your math test. But for a lot of people my age, that's exactly what it is. I have a friend who started vaping in middle school. He told me and himself that it was just a phase, something flavorful. But now he's smoking cigarettes. It's advanced and his health has deteriorated. And that's why earlier, our Youth Advisory Commission has advised the City of Oregon City to support at the state level a flavored tobacco ban like 702A. And I believe that there is a little bit of a misunderstanding about how teenagers get nicotine products. At least everyone that I know that has smoked or does smoke do not just walk into a store and get it. They get it from other people. They get it from dealers who know people that are over 21. So the fact is, like, you don't get carded, yeah, because they know other people that are over 21 that are buying it for them. So there's a little bit of miscommunication between that. And it's not just teenagers walking in. It's more than that. So I'm asking you today to support SB 702A for me, my classmates, and for every kid who deserves better than this. Thank you for listening.
Chair Meek, Vice Chair McLean, and members of the committee. My name is Ruby Weigler. I am 14 years old and I will be starting at Franklin High School in Portland, Oregon this fall. Senator Taylor is my state senator. I'm here today to urge you to pass Senate Bill 702-A. Young people today are still vulnerable to the marketing of tobacco products, particularly those with flavors. Restricting access to products to adult-only retailers is a clear, effective way to look out for young people like me. Next year, I'll be entering high school. It's a big step in the transition from being a kid to being an adult, and I will have a chance to make new friends and explore new things. Too many start experimenting in high school with tobacco, particularly flavored products, that can put them on a path to a nicotine addiction. One young person I know, like many other kids, had struggled with mental health issues and turned to vaping flavored tobacco to cope. He became a regular user, only contributing to further decline in his physical and mental health. Allowing easy access to these products has led him and others to damage their health. As legislators, it's your responsibility to protect me and other kids from making bad decisions that we will come to regret. Senate Bill 702A is a simple, straightforward way to do that. I urge you to vote yes and make this the law in Oregon. Thank you.
Thank you so much. Any questions? Well, I just want to thank you so much for coming. It's very important to hear our youth and your perspective. It was mentioned earlier, I was at the tender age of 18 after smoking for 6 years trying to quit. And because I was wanting to begin my life in the military and really just trying to take care of myself. So understand the addictions of it, and I really appreciate your leadership on this. You should be commended, and thanks for coming. Have a great day. Okay, now I'd like to call up Richard Burke. On deck, Jason Weber, Raymond Slason. 2 minutes. Welcome. Yeah, 2 minutes each. Yeah.
Thank you, Chair Meek and members of the committee. My name is Richard Burke. I represent the 21 Plus Tobacco and Vapor Retail Association of Oregon. It's 72 stores, 3 distributors, and 1 manufacturer. The retail stores only allow people 21 or older on property. It's not like gas stations, convenience stores, or anything else. Now, we oppose 702A. We think it is like a job guarantee program for people in the black market. If you want to make sure that you give money to killers and social predators who sell laced vapes that contain methamphetamine, fentanyl, and other products, and Chinese import that's obtained on the internet, then yes, do something like a ban. But if you insist on limiting them to 21 plus stores, the OLCC is not the way to go. Use our stores. Our stores already allow 21 plus. They are privately run, they are monitored, they are regulated, and if the state is not going to be allowing retail grocery stores, convenience stores, and gas stations to sell them, there will be adequate enforcement resources to do the 21 plus stores. Our association promotes the use of those validation devices for IDs. We also think there are other ideas. Make sure that only people who are 21 years or older can sell at retail stores. Make sure that people who are trained and sell to minors are penalized along with the owners. There are a lot of things that you can do short of a ban that will not feed the black market, all the negative unintended consequences that come with it, blow a hole in the state's budget. But also, the FDA has admitted that most of the deaths that have occurred because of vapes have been through black market products that have been laced with other chemicals. So don't feed them, and vote no on Bill 702A. Thank you very much.
Thank you for coming. Appreciate that. Jason. Raymond. Jason Weber. Mr. Weber. Yeah.
Thank you. Chair Meek, members of the committee, my name is Jason Weber, owner of Vape Crusaders. I have 5 locations across 3 counties and 25 direct employees in this state. This is my life's work and my passion. 11 years since the start of our companies now. Not only did I get married recently and purchase my first home, but I have employees who have been able to do the same thing. This is our life. My district manager is on maternity leave as we speak. Could you imagine being in your early 20s, working your way up in a company for 6 years, to be able to get married, buy a home, have a baby, and then come back and be told you no longer have this career? I am an expert on vapor, more than anyone in this room. I manufacture in an ISO Level 7 lab, wholesale and retail. I know the science, advocacy, pros and cons like no other. I should be used for my knowledge. I have to believe a lot of people in this room know this bill is wrong, or they wouldn't have to use blatant lies to push it. The opposition gets the facts on smoking right, but then in the same breath switches to talking about vaping to deceive. It's sickening when doctors and pediatricians lie, or when the politicians and health groups cherry pick dates rather than giving you updated info, when they use propaganda that's long been debunked. Allow me to present some actual facts. EVALI was from THC carts, not nicotine. Vapor will never exceed 5% of the risk of smoking. Youth vaping is down 70% in the last 5 years. Youth nicotine consumption is at a 10-year low. Nicotine vaping has 0 tar, 0 cancer, and causes 0 lung disease and 0 deaths. Contrary to what a certain representative wanted you to believe last hearing, the DOR said that we went from 22% carding failure in 2022 down to 14% in 2024. Lastly, we are the same as a liquor store. In fact, we begged to be under OLCC for the last 8 years. We are 21 at the door without the burden of selling sin products. So why would you give our businesses away instead of including us in it? These C-stores will hurt by the absence of flavor products, but it's our entire business. I don't have groceries and other stuff to fall back on. This is it for us. Please don't restrict access to this life-saving technology, and please don't ruin my family, my employees, and their families' livelihoods. Please just let me sit down with you guys. Let me show you facts and science. Let's come up with a good solution together. Thank you.
Please, thank you for bringing this testimony forward.
Yes,
We're
sir.
not aware of a lot of the industries out there.
Thank you.
Thank you very much.
Mr. Raymond Slason.
Yes, sir. Thank you. My name is Raymond Slason, and I own Slauson Enterprises with a 2-chain store.
of vape stores, and my stores are 21 and over. So to make that clear, I want to thank the other speakers, by the way. They touched on our compliance record, which is close to the OLCC's goal of 90%, which I think the vape stores in Oregon would meet that goal next year, unlike the liquor stores that we're going to put these products in. So the other thing I want to talk about is there are almost 300,000 vapors in Oregon and another 200,000 menthol smokers in Oregon. So you're talking about 500,000 customers to be divided up between how many? 200, less than 200 stores? I mean, obviously, this is ridiculous. You're talking about thousands of new customers per store. Most of these customers shop a couple of times a week. So how are they even going to be able to handle this? My stores are 21 and over. We card everyone. We are compliant as we can be. I hire adults only over 21 to work for me. And this will be the end of my companies, the end of my employees. And, you know, it's a rather draconian bill. I would like to see us tobacco stores that are 21 and over placed into the OLCC as well. I think that's a simple solution. Obviously, going 21 and over is a simple solution. Just put it in 21 and over stores. Because grocery stores and convenience stores, yes, they will take a hit from this, but this will not be the end of their industry and their business, which it will be for me and the speaker before me. And anyways, I really hope you consider adding an amendment to make this a 21 and over only, and expanding it to stores like mine and the other speakers here. Thank you very much.
Very good. Thank you for your brevity and very powerful testimony. Okay, I'd like to call up Cynthia Branger-Munoz, Maya Puello von Geldern, and Heidi Lowe. And thank you for your brevity and 2 minutes each. And for everybody else, please, when you come up, I know we all have, I would recommend coming up, telling your compassionate story, being limited to 1 minute. I'm trying to get everybody up, tell us you oppose, support, and we do want to hear from you. I do appreciate you coming. Welcome.
Good morning, Chair Meek, Vice Chair McLean, and members of the committee. I am Heidi Lau, Western Region Advocacy Director at the Campaign for Tobacco-Free Kids and an Oregon resident, and I'm here today in support of 702A. We support passage of this bill to significantly reduce access to flavored tobacco products. By requiring these products to be sold only in OLCC liquor stores, we're taking a meaningful step to protect the health of Oregon youth. The policy would dramatically change the convenience and accessibility for youth in particular. I've submitted written comments, but I'm going to take my time today to address some of the things that have been said at this hearing. Although flavored tobacco products will be sold in OLCC liquor stores, the regulatory structure for tobacco compliance will remain the same with the Oregon Health Authority Tobacco Retail Licensing Program. Even liquor stores who wish to sell flavored tobacco products will also need to obtain tobacco retail licenses, which more than half already do. Annual inspections and compliance for tobacco retail will remain under the purview of the Oregon Health Authority or the local public health authority. SB702A does not change this reality. The statistics cited by the Northwest Grocers Association are not about compliance with tobacco retail licensing requirements. Unflavored tobacco products will remain available at all licensed tobacco retailers, which are products that the data tells us most adults typically use because once you're addicted to nicotine, you don't need the flavored product. While Washington and Multnomah County have taken a wise public health approach in ending the sale of flavored tobacco products, the tobacco industry has spent the past 3 years fighting this in court at great cost to the counties who are working to improve the health of their communities, which not every county has the ability to take on. The legislature must take action to implement these policies now. Pre-marketing FDA approval is the process all new tobacco products must apply for, and it only allows a product to be on market. It does not approve it as a cessation device. This is a separate process. Any tobacco product may apply for FDA approval as a cessation device if approved. It will not be included in the provisions of this bill. To be clear, there are currently no e-cigarettes or nicotine pouches that are approved as cessation devices. The tobacco industry—
I'm sorry, I have to ask you to conclude.
This bill is a step forward we should take to protect the health of Oregon kids and give us the opportunity to make a great long-term difference. That's why we urge you to vote yes on 702.
Thank you so much. Sorry about that. Welcome.
Chair Meek, Vice Chair McLean, and members of the committee, I apologize. I'm losing my voice, so I'll be brief. For the record, my name is Cynthia Barnger Munoz, and I'm here on behalf of the Oregon Education Association, which represents more than 42,000 members across the state, including classroom teachers, education support professionals, to community college faculty, and school nurses. So our members work in every corner of Oregon, serving students from preschool to higher education. We are here in strong support of 702A. I will say that I want to uplift what our youth have said. What that reflects what I hear from our members. Our members are united to make sure that students succeed, and so we strongly support this bill because flavored tobacco and nicotine products are flooding our schools and putting our students at risk. Educators are seeing impacts daily of these products on learning, with students who struggle to focus, manage their emotions, and stay present in school because they're dealing with addiction. I've heard concerns raised about the possibility of illegal or unlicensed sales, but it's important to clarify that Oregon already has laws on the books to address the black market and unlicensed sellers. This is a separate issue, and it shouldn't be used to justify continued legal sales of flavored products that are harming our kids. This bill takes meaningful steps to reduce access by limiting where these products can be sold. These are practical and necessary changes that will help protect our health, the health of our students, and support safe, distraction-free learning environments. My full remarks are on OLIS, and I will keep it brief.
Thank you so much. Appreciate that. Ms. Von Geldern, please.
Good morning, Chair Meek, Vice Chair McLean, members of the committee. My name is Maya Puea Von Geldern. I'm a mom of elementary and middle school kids, a small business owner, a substitute in our school district, a PTA leader, and a community advocate. I spend every day advocating for kids, and I'm here in support of SB 702. We are and come from generations who were lied to, who were tricked into smoking cigarettes. In some of my favorite childhood movies, the cool kids were smokers and cigarettes were a hint to the end of adolescence. We were tricked into thinking smoking made people look sophisticated or cowboy rugged. We all knew the Marlboro Man who crossed desert canyons and mini-mart windows with a cigarette in hand. Spin tactics are focused in on our kids. They are still being tricked. These flavors that should describe slushies rather than tobacco are in their faces daily in the corner markets. What better way to lure kids in? We've heard the many ways that nicotine affects the brain. The effects that stand out to me as an education advocate are those that affect children's moods, their impulse control, and attention span. My brain flashes to the headlines that emphasize the learning gaps our kids are facing in our state, and yet here we are, tempting children with something we know will make things even worse. I mean, we're seeing tobacco use seep into elementary schools. Aren't we supposed to be doing everything we can to set children up to succeed? Shouldn't we be addressing issues holistically so that our kids do have a chance at success in all areas of life? My 7th grader can tell me exactly which classmates use flavored vape products. They like the way it tastes like candy, he says. I worry about his curiosity being piqued simply because his friends have justified why they like them. If you've ever lost a loved one or to lung cancer, as our family did almost 2 years ago, or have even only watched a loved one battle tobacco addiction their entire life, you should want to do everything you can to prevent others from the same suffering. We know that kids get these products despite responsible store owners. We know that while they might not buy them themselves, they know they exist because they see the products every day and they've proven that they know how to get them. By removing these products from the stores where children are allowed to come face to face with them, we remove the temptation that our kids are too young to navigate. To small business owners, I'm sorry for your loss in sales. I am, but maybe it's time to start finding responsible products to sell instead. I'm a small business owner. I know what it's like to have to shift focus. I'm less concerned with the loss of tobacco sales than I am with the loss of life that results from tobacco use. We must deter children from falling into the trap of lifelong addiction.
Please
I'm finishing up. This is the last 2 sentences. Some advocate for spending more money on warning people that tobacco kills. How about we just make it harder for tobacco to actually kill? Let's instead preemptively address nicotine addiction so that we're not raising the next generation of people needing to learn how to quit. Thank you for your time.
Mr. Vasani, you're here. And Kevin Kumar. And then online, let me see, actually, yep, online, it's Kevin Kumar. Welcome. I'm jumping around a little bit. Try to meet, allow people in person. And then Frank Schuchard. If you're here. Welcome. Sorry about that.
I'm going to make it quick as I can. Thank you, Chair and members of the committee. My name is Sam Masani. I'm the owner of Speedy Market, Halsey, and Step-In Market in Portland. I'm also a proud father of two, and I take my responsibilities as a father and a business owner very seriously. As a business owner and father, I'm very busy. Taking time out of my day to drive to the Capitol, it's not easy, but this is important. I value the opportunity to be a part of this conversation. I'm here today to ask you to vote no on Senate Bill 702A because I believe it is not good for Oregon. This bill would move all sales of flavored tobacco and nicotine products to state OLCC liquor stores in Oregon. This is the wrong move. Tobacco products make up approximately 35% of my total in-store sales. Of the 21 plus category, you would be eliminating 75% of my customers' product choices, which would include menthol cigarettes, flavored dip, and other flavored tobacco and nicotine products. This would not only harm my business and other lawful businesses like mine, but would increase crime and create an even bigger illegal market for tobacco in our state by increasing demand for bootleg products sold through illegal channels. My business make every effort to keep tobacco and vapor products away from kids. Retailers are the front lines of conducting ID check for age verification every day. Reasonable restrictions to keep tobacco and vapor products from getting into kids' hands makes sense, but banning 21 plus flavored tobacco from 93% of stores in Oregon does not solve the problem and only creates others without achieving any benefits to the public health. Please support Oregon's small business and our effort to prevent youth access to tobacco products by opposing 702. Thank you.
Thank you for coming today.
Appreciate
We
it.
appreciate
Thank
it.
you.
I understand your sacrifice. Mr. Kumar, online, if you're there. And then on deck, I'll ask for Daniel Moltke.
Good morning. My name is Kevin Kumar. Thank you for the opportunity to speak. I'm here today to discuss the negative impact a tobacco flavor ban on licensed tobacco retailers would have on small businesses and to ask you to please oppose Senate Bill 702. My family owns several convenience stores on the Oregon coast. We've been serving our community for years, providing good jobs that support 15 families, donating to local organizations, and ensuring our customers have access to essential goods. We take compliance very seriously, especially when it comes to tobacco and nicotine sales, and we have passed all our underage checks by the OHA. Flavored tobacco products are a key part of our business, not just because of the direct sales dollars, but because they also bring customers into our store. If this bill passes, we will see a drastic drop in revenue in our stores, forcing us to make tough decisions, whether that's cutting jobs, reducing hours, or scaling back our contributions to the community. Limiting the number of retailers in Oregon legally allowed to sell flavored tobacco products to just one store per city could encourage illegal markets to step in and supply these products to meet consumer demands. And that's the reality. A lot of rural areas do have just one liquor store in the city. Oregon is already experiencing declining tax revenue from tobacco products due to the decrease in demand. This bill would worsen that issue and would cause hardships on responsible retailers who follow the laws. Please oppose Senate Bill 702. Thank you.
Thank you. Appreciate your brevity. Welcome, Mr. Moltke.
Thank you, Chair Meek, Vice Chair McLean. My name is Daniel Shaheen Muqtadari Moltke. In addition to being Chief of Staff to Representative Vanessa Hartman, I also sit on the board of several Iranian and Arab cultural organizations in Oregon. I also play violin with the National Arab Orchestra. I'm here in my personal capacity as a Middle Eastern Oregonian. And you might be wondering why I am talking about my Middle Eastern heritage. Well, that has to do with this bill. While SB 702 might not say it outright, by restricting flavored tobacco sales to OLCC licensed liquor stores, this bill would effectively shut down Oregon's hookah lounges because they are not allowed to sell liquor. That would be a massive cultural loss. And an insult to generations of tradition. And in typical Persian fashion, I'm going to read you a short poem. The reed becomes sugarcane in your mouth. It's not tobacco smoke that envelops your face. It's a cloud that circles the moon. That was written about hookah in the 16th century by the Persian poet Ahli Shirazi, meaning that the water pipe has been a fixture of Middle Eastern social life for at least 400 years. Centuries before vapes, hookah was the subject of art, of metaphor, of longing, just described in the language of love and beauty. And in my written testimony, I'm going to include paintings of people smoking hookah bases like this that are inscribed with poetry about the hookah from the 16 and 1700s. Over the centuries, it's become a symbol of hospitality, community. It commonly appears in Islamic architecture and on the balconies of Aleppo, cafes in Beirut. It's all over the Middle East. So when I see ads saying hookah isn't cultural, I have to laugh because if hookah isn't cultural in the Middle East, then neither is baklava, Arabic calligraphy, or fighting over the check at dinner, which my dad loves to do. Yes, some conservative religious groups have tried to ban it before in the Middle East. They have failed. And no offense, I don't think that if the Ayatollahs and mullahs of the Middle East could get rid of it, I don't think we should do that here. I'll just close shortly by saying most Middle Eastern Americans are not Muslim. Most Muslims are not extremely conservative. They don't support these bans. We've already had our communities under attack. We already don't feel safe here. Taking away what is really our last cultural space, one of the few spaces that all of us come together, Christians, Druze, Jews, whoever, Muslims, taking that space away in the name of public health, I think is a mistake. My grandmother, my dad just recently reminded me my grandmother used to love smoking hookah, used to put mint in hers as well. And so I urge you to please add an exemption for hookah lounges through an amendment to this bill. Thank you.
Thank you so much for coming forward. Appreciate that. Okay, I now have James Bishara and Carrie Nyson. Is James Bishara here? And they're remotely. James Bishara, are you there? We will put on pause for a minute and go to Carrie Nyson. Welcome.
Good morning. My name is Carrie Neeson, and I'm with the American Lung Association, working to cut my testimony to be as brief as possible. What I know to be true is tobacco use is directly responsible for $1.79 billion in healthcare costs and another $3.7 billion in productivity losses in Oregon each year. Reductions in tobacco use will save millions of dollars in healthcare savings. Maybe not tomorrow, but surely in our future. Restricting the sale of these flavored products will work to prevent our youth from ever using tobacco, so we'll never incur those health burdens that would happen if they did use tobacco. The tobacco industry has targeted Oregonians with menthol for years. My dad, when he was in the Army, that's what got him hooked on cigarettes. The first cigarette he had, he didn't like. It didn't taste very good. Another friend offered him a cigarette, and he thought, well, I'll try this one. It was a menthol cigarette. It went down easier, it was smoother, he liked the taste, and he smoked for decades later. Tobacco use remains the leading cause of preventable death in Oregon, and we need to curb the long-term cost of tobacco, and one of the ways that we can do this is to prevent our youth from ever starting to use tobacco products. This is the right thing to do. We need to protect our kids. We can do it. We can make a difference if we act today, and not only are we saving the lives and the health of kids today, but tomorrow's youth as well. So please consider this, and I urge you to pass it. Thank you.
Thank you for your testimony. I mentioned Frank Sheward. Is Frank here? And then actually, I'd like to call Legislative Counsel, if you're here in the room, maybe come forward to answer a question. Thank you regarding the, thank you, and just please introduce yourself.
Chair Meek, Vice Chair McLean, Marisa James, Chief Deputy Legislative Counsel. I didn't draft this bill, but I'm happy to answer questions if I can.
Yes, thank you. The question has come up, Zen, like, for example, a nicotine-based product, I don't know the full, proper, is that a federally regulated product, age restricted?
Well, what I know is that It's unlawful for any retailer to sell, under federal law, to sell a tobacco product to any person younger than 21 years of age. I'm not sure if that answers your specific question about the type of product.
Would Zen be considered a tobacco product? Zen is a nicotine pouch.
I do not want to, a nicotine pouch. If it is considered a tobacco product, then it is. I'm sorry that I'm not an expert on this issue.
I don't believe that Zyn is only synthetic nicotine, and it's not made from tobacco at all. I think Dr. Reynolds might. I think she's looked into this.
Well, go ahead, Vice Chair McLean.
I think these are information we can certainly get accurate so that we aren't speculating.
Yeah, absolutely.
And one thing's for sure, I think this committee, before we take a vote, needs to get accurate information.
Is Sarah Wiley, are you a legislative counsel on Teams? Or are you a doctor?
Hi, good morning. My name is Sarah Wiley. I'm the manager for the Tobacco Retail License Program at the Oregon Health Authority, and I'm happy to answer the question about regulation of tobacco-derived and synthetic nicotine products, if that's helpful for the committee.
Yes, it would be very helpful. Thank you. Can you answer that, what we just posed?
Certainly. So Senator Meek, the synthetic and tobacco-derived nicotine products like Zyn are not currently regulated under Oregon law, which means that we cannot inspect for them in the Oregon Tobacco Retail License Program minimum legal sales age inspections. They are regulated federally. However, federal enforcement is very limited, and with current terminations of staff at the federal level, we expect that that will go down even further. And we do know that these products are sold to youth in Oregon from the reports from the federal government. House Bill 2528A would address this loophole in Oregon tobacco laws, and so I would refer the committee to that bill. Many of those loopholes are also addressed in Senate Bill 702A.
Okay. Thank you so much. I think Vice Chair McLean has clarification.
Yeah, I think the advocacy for the bill by the Oregon Health Authority excludes us necessarily from getting what we wanted, which was accurate and unbiased information. So one thing's for sure, what at least the advocate from the OHA for the bill said, is it's regulated at the federal level. Okay, so we can all agree it's currently illegal to sell the product to people under 21 if you're talking about a Zyn product or a vape product, right? And if you're talking about a flavored tobacco product like Skoal or Kodiak or whatever, that's banned under 21.
In Oregon, yeah.
Right. So at least we can have a discussion where there is agreement on some of those facts.
Thank you, Vice Chair McLean. What I would ask from Legislative Council is we will specifically write what questions we have to clarify, and if we can get an unbiased legal opinion of what is not happening or occurring, or the regulatory authority, both federal and state.
Yes, Chair Meek, that sounds great. We will quickly answer your questions in writing, or if you want to chat further. So,
Great.
Thank you.
Thank you so much. I just want to let the witnesses know I plan to stay here until we're exhausted with this, or until I get kicked out of this room. So, would like to now call.
Chair Meek?
Yes. Yeah.
Could I just? I guess I would like to dissent that I did not hear the Oregon Health Authority advocating for any bill. I heard them sharing information. I think I would dissent. I would disagree. I mean, we can agree to disagree, but I did not hear advocation. Yeah.
Okay, we will continue that debate. No, I thank you. Yes.
That's just my opinion.
I understand. Let me take it back to our list here. Want to talk, pull up, did I call up James Bashara online? Okay, did that. Let me see here in person. Saif Tajik, welcome. And then Tai Win.
Good morning, Chair Meek and committee members. My name is Najib Tajik, and I'm proud to represent my family, a hardworking small business owner who operate 3 stores in Portland area. Today, I urge you to oppose Senate Bill 702, a proposal that threatens businesses like ours, our employees, and the community we serve. The American dream under threat. My family came to the United States in 2014 with a vision. In less than 2 years, my brother bought his first store. Through hard work, our family grew that single location into 3, supporting local suppliers and serving neighborhoods that rely on us for groceries, household essentials, and responsible tobacco sales. We're part of the solution, not the problem. Let's be clear, we take our role in preventing youth access seriously. National smoking rates are at a historic low, just 1.3%, thanks in part to the training and the vigilance of retailers like us. We ID every customer, we follow the law, we're invested in our community's health. Pushing flavored tobacco sales exclusively to liquor store won't stop youth access. It'll just devastate small businesses while doing nothing to address the root issues. Oregon economy is already fragile. Convenience stores are closing. Now, Senate Bill 702 wants to strip sales from 3,800 licensed retailers, many immigrants and family-owned. This isn't regulation, it's just economic consolidation that benefits a few at the expense of many. We're not asking for a special treatment. We're asking you to preserve fairness, protect jobs, and avoid unintended consequences. Vote no on Senate Bill 702. Stand with small businesses. Stand with Oregon families, and let's work hard on real solutions, not policies that will shutter stores and deepen economic pain. Thank you.
Thank you. Welcome. Ms. Nguyen.
Yes, thank you. Thank you, Mr. Chair, member, and the committee. Thank you for giving me the chance to talk today, and I believe I only have 2 minutes, so I try to wrap it up everything. I come here and strongly oppose for the Senate Bill 702A. The reason why, because I work for one man, his name is Sanjay Prasad. He had a 4 store in Oregon, and in our hand we had about 15. The Oregonian worked for us more than 5 years, and we strongly support for the community by do the non-profit prayers group in Salem, and also his success just not for his own, is for the community, for employee and family member and people around us. And also our really responsibility for follow the pay tax and follow for the ID restriction. We ask for everybody for the ID. Also, we ask for the ID even people try to buy even the lighter. We try to stop people who smoke, but honestly, with this bill, I feel like it really hurt our store because we follow a rule, we pay tax, we selling everything we can, but think about people who don't pay tax, and when you cut off everybody in here know about the supply and demand. When you cut off the demand, you guys cannot cut off demand, but you guys just cut off the supply from the people, so they will find a source to buy it. I mean, the chain for a black marker is higher, and over there they don't ask for ID. I'm the stepdad of 2 daughters, and I believe grow the kid, protect the kids. It's not only for retailer, it's from the family. And the family need to protect the kid and strongly keep them stay away. Not only the retailer, because retailer we sell for people who had ID and who over 21. And in here, I urge you please vote no for the Senate Bill 702A. Do you have any question for me?
No, thank you so much, and I appreciate your willingness to come and sacrifice coming here to Salem today.
Yeah,
thank you. Okay, I have, hold on, Trevor Olson in the room, Trevor Olson, and then Marcia Kelly. And then online have Taya Lazon, if you're there. and Rafe Haza. Marcia, you want to come up, please?
Chair Meek, Vice Chair McLean, members of the committee, Marcia Kelly, the Oregon Women's Rights Coalition. We're in support of Senate Bill 702A and feel that keeping our kids away from nicotine products will eventually pay off and result in a healthier America. I understand the concerns of those who sell products, but maybe they can find things that kids would like that do not harm their health and put those in their stores instead. Thank you very much. So I urge support of this bill.
Okay, thank you, Marcia, for coming. And going through my list here, making sure. Brett, well, actually, Mr. Haza, yes, please.
Yes.
Unmute yourself, sir. You have the floor. 2 minutes.
Can you hear me now?
Yes, I can.
Okay. Good morning. My name is Rafi Haza. I own 2 tobacco shops in downtown Portland. Vapes, menthol cigarettes, smokeless tobacco is almost 70% of my sale. I started my business in 1992. Then retailers implemented and supervised themselves for selling tobacco. Fast forward to today, you asked us to post age restriction, we do. Train employees on how to sell tobacco, we do. Pay for extra license to sell tobacco, we do. We constantly get inspected by the state and the county. We constantly catch minors sent to us by officials, and they fail to go through. We are doing everything you're asking us to do to sell tobacco. If this bill passes, you're asking me to close my stores and fire most of my employees. We don't hire people with a college degree. We hire people from the street, barely finished middle school or high school, or actually they are in recovery. I have one employee that he's been working for me for 8 years. He came to me asking for a job. He said he wanted to quit drugs and sleeping on the street. He wanted to pay child support so he can see his child. He wanted to work for the money, not begging for money. Now he sees his child every weekend. He's paying child support and he is paying his own rent. He's happy with his life. Do you want me to fire this person or this employees if this bill passes? I guarantee you the stress of not having a job will make him go back to use the same drugs that almost ruined his life.
Thank you, Mr. Hazan. I really appreciate your perspective and sharing how this affects you and your business and your community. Dr. Pritka Kumar, if you're online, please. And then I have County Commissioner, where it go, Patty Adair, if you're still there. Welcome, Doctor.
Thank you so much. Good morning. My name is Dr. Pritika Kumar. I have worked in harm reduction research programs and policy for the last 25 years in settings such as United Nations, academia, integrated health systems, and now I serve as a director of scientific engagement for PMI US Corporate Services, Inc., which is a part of Philip Morris International and its family of companies. PMI has not and does not sell combustible cigarettes in the US, offering instead a portfolio of smoke-free, FDA-authorized products, including ZYN nicotine pouches. Thank you for the opportunity to discuss our opposition to SB 702. In January, the FDA authorized 20 variants of ZYN, including flavored and unflavored, determining that ZYN is appropriate for the protection of public health. And that is what was the FDA's authorization, in part because youth use remains relatively low. Under SB 702, most varieties of ZYN and other FDA-authorized smoke-free products would be banned. experts have consistently found that flavor bans have significant unintended consequences, decreasing the appeal of less risky products for adults who smoke, hindering switching to better alternatives, and leading to increases in the use of combustible cigarettes. States that have adopted broad bans on flavored tobacco products also experienced a sharp increase in the illicit marketplace, resulting in increased criminal activity, burdens on law enforcement, and expanded access by youth due to lack of age verification in the black market, not to mention reduced tax collection and compliance. SB 702 would have catastrophic consequences, fail the over 55,000 Oregonians who lose their lives every year to illnesses related to combustible cigarette smoking, contradict Oregon's record on supporting harm reduction policies, and jeopardize the state's tax revenues and Tobacco Control Authority. I urge you not to advance this bill, and I would be happy to answer any questions. Thank you so much for your time.
Thank you, Dr. Kumar. No questions. Thank you for coming. Is Commissioner Adair still online? Okay. How about Yesenia Morales-Santos? Yesenia? And I know we're past our committee time. All of the remaining testimony is all remote, and unless there's anybody here in the audience that signed up that I did not call. Yes, sir, please come up. Thank you for your patience. And just introduce yourself. And you'll be our final witness, and I just want to reiterate to everybody that appreciate everybody's coming today. Very important testimony, a very important decision Oregon has to make. And you have up to 48 hours from the beginning of this meeting to submit written testimony if you have not already. Welcome, sir. I don't have your name down, but
yes,
introduce yourself.
I originally signed online, and then I sent an email to switch it to in-person because I thought it is important for me to be here.
Welcome.
And talk to you in person. My name is Naeem Khan. I'm a franchisee and small business owner for over 22 years. I am married to my beautiful wife, Jamie, and I have 3 kids. And my sons, twins, they are junior in the high school. And my daughter, she is in college. And you have heard, and I've been sitting back there and I heard all the data. I have the notes, but I want to tell you my story. I'm a parent. I'm a father. We educate our kids in our house. We teach them what's right, what's wrong. My kids, they're athletes. They play lacrosse, they play football. They come and we sit on the dinner table. We talk about about the nicotine addiction, about the cigarettes. My dad, he was a cigarette smoker. I come from a family of 10. None of us smoke cigarettes. None of us take any nicotine or any pouches like that. So the reason I'm saying that, I think it is important that we as a parents take the responsibility and teach our kids what's right, what's wrong. Kids are smart. They can get their hands on nicotine anywhere. I am a retailer for over 22 years. We have system in place. We scan ID for everyone who comes and buys cigarettes. We just don't ask for the ID, we scan it. If you don't have it, I'm not gonna sell it to you. And that's how we do. I don't think it's fair that you pass something, take 30% of my sales and give it to the liquor store, and data shows that they're not even doing their job right. So I support my family. I came to this country in 1989, worked hard every single day. Please, please do not take that 30% sales away from me. Tobacco customers are important to us. They're not just buying tobacco. I'm just going to take 30 seconds and conclude it. They're not just buying cigarettes and tobacco
Sarah,
from us.
Will you text your mom and tell her I'm still on my call and stop texting me?
Please unmute your mic, or mute your mic.
So, Senator Meek, so I'm going to continue. So, He just took 10 seconds away from me, so I'll keep going. So the customers, when, like Vice Chair Senator McLean, if he's coming to my store to buy Zyn or anything, he's not just buying Zyn, he's buying water, he's buying food. We sell other product. But if you take him away from my store, I'm losing the other sales that I can get it from Senator McLean. It's important to us. And taking 30% of our sales, you're forcing our hands to either let the employees go or close our stores. It's not fair. Thank you.
Thank you.
I
Mr.
oppose.
Khan, is that right? Mr. Khan, is that right?
Yeah.
And without impugning Vice Chair McLean, I'm guessing he may be buying a six-pack of beer, too.
Yeah, exactly. Exactly.
Thank you so much. Just kidding. Thank you, everybody. I am now closing the public hearing on Senate Bill 702A, and want to just thank everybody for your patience and time and your dedication to come and be part of the Oregon process, of us listening and understanding and seeing all perspectives of the health concerns we're trying to address, economic issues, your families that will be affected, some major decisions to be made, and you're going to help us to formulate, a good answer. So I thank you so much. That being said, our meeting is adjourned.